Welcome back, everyone. Next, we have Ethema Health Corporation. It trades on the OTC Pink sheets under the symbol GRST and operates in the behavioral healthcare space, specifically in the treatment of substance use disorders. Please welcome Chairman, CEO, and CFO, Shawn Leon. Nice to see you, Shawn. How are you doing today?
Good. Thank you, Anna. Thanks for having me.
Wonderful. The floor is yours. Call me back when you're ready for questions.
Okay. All right, everybody. As Anna said, we're in the behavioral healthcare treatment of addiction and substance use disorders. I'll go through this presentation. The first thing is all of us usually do is require you to read the disclaimer, which you can all do at your leisure. But it's here as part of the presentation, and I'll skip right to our executive summary. So we currently are owners of a treatment facility in West Palm Beach. This is a 68-bed facility. We've been open since 2021, and we are looking to expand to approximately 500 beds in the next 2 years throughout the U.S. Southeast. We're currently in Florida, and we would expand in and throughout the U.S. Southeast. We have a very experienced management team. As you'll see shortly, we've been in this business with different treatment centers since 2011. And a quick note, a standard valuation on an inpatient treatment center company could be in the $300,000 range per bed. So we would be looking at producing a enterprise value of about $150 million with a 500 bed complement of various treatment centers. We plan to only operate in-network facilities. There's been a history of people in out of network and in network, but predominantly better and safer and much better for larger companies to be in the in-treatment space. Sorry, I skipped ahead here. In-network space. We are looking at an equity investment this year of approximately $5 million. We'll talk more about that. We do have an existing Reg A up and approved. And the other thing that we expect to do in 2024 is an uplisting to New York Stock Exchange American market. So that's sort of an overview of where we think this company will be going in the next little while. Sorry, back up here. Some of the factors for success, obviously a huge and growing demand. We treat various addiction treatment disorders, alcohol, drugs, primarily. So as everyone knows, we have an epidemic in this country and a huge problem. We've got the ability to be flexible, including increasing or adding mental health as a primary diagnosis. So we have lots of flexibility in how we can grow. We have an ability in our current facility to increase patient capacity. We still are not up to full capacity in that facility. And that is something where we're on the verge of being at full capacity throughout this coming year of 2024. Another thing that we're looking at doing and able to do is value-based pricing. This is something the insurers are looking at. And for lack of a better word, it's kind of like guarantees or guaranteed treatment. You get a sort of more of a fixed price or a price based on outcomes. And that's something that's up and coming and is going to happen in the treatment business. And it's certainly something we can provide. We are very effective at treatment for opioid addictions. Obviously, that's the toughest one to treat. It's not new, but it's the latest, hardest, and most difficult addiction to treat. We'll talk a little bit more about that and the problems associated with that. We are all in network. We have about 12 contracts with various insurance companies. We primarily do most of our business with 4 different insurance companies. We have a best-in-class facilities, proven management, and we can do very low-cost, high-speed expansion. So we're set to be very successful. We are successful now. We can set to continue to be more successful. So a little bit more about our background, our company, and the market overview for everybody. As I said, we've been in the business since 2011 under this public company, Ethema Healthcare. We first started in Canada with a treatment center there, 41-bed treatment center. We built that from scratch. It was a private pay treatment center. Different payment system in Canada versus the US. The insurance market doesn't exist there because it's government medicine. But in any event, we started a private pay treatment center, became very successful. And over a period of about 6 years, we became renowned for being one of the best treatment centers in Canada. Our claim to fame is partway, through that tenure. Our famous mayor, Rob Ford, that, admitted that that's where he had his treatment, brought us a lot of notoriety. And that was something that helped put us on the map a little bit. And when we were looking in 2017 to expand and maybe grow into the US, a private equity firm that didn't want to necessarily support our growth did choose to buy us. So we decided at that time in 2017 to sell the Canadian operation. We sold that for $10 million, kept the real estate in the company, and then launched out into the US. And our first foray in the US was a partial hospitalization. So it was only one specific treatment modality, which is called PHP, or partial hospitalization. It's a 32-bed center. We bought the real estate and the business in 2017. And then look to expand and grow into residential and addiction and detox. So in 2018, we'd entered into a purchase agreement for a much larger facility. It's a 168-bed facility in West Palm Beach. So we moved all of our operations from Delray Beach up to West Palm Beach. And we entered into basically a firm or hard contract to purchase the facility, which is an $18 million facility. We got the facility licensed and open under a lease while we were trying to close. And that was really a misstep on our part. It was too big of a facility. It was too difficult. I have a long background in real estate ownership and development, and just underestimated how difficult it was going to be to close on that deal and get mortgage financing. And ultimately, we failed to close on the real estate, which was sort of happening in late 2019, and ultimately lost the lease on the facility. And at the beginning of 2020, as everyone knows, that's when COVID hit. So we were, it was kind of a triple whammy of losing the facility, not being able to continue with our lease, having COVID start. And at that time, we did have a lot of toxic convertible debt. And, we really had no choice but to let, the debt holders start to convert. And that's where we really, lost control of our shareholder base. And, ultimately, these debtors took us from about 150 million shares to almost 3.7 billion shares. And, we were without a facility. So we almost simultaneously at that same time identified a new treatment facility in West Palm Beach that was available. And at the beginning of 2020, we negotiated to buy 51% of that operation for $0, but in return for financing the opening of that new facility. And by late 2020, we got that facility open. Early 2021, we bought an additional 24% of that operation, giving us 75% of the operation. And that operation in 2021, 22, and 23 became, very good, profitable. We expanded it a little bit. We added 10 beds next door. And today, where we stand at the end of 2023, we have, a very successful operation in that one facility, and we're looking to grow and expand and ready to grow and expand. Part of the issue we had with the failure to close on the other property was we raised a lot of debt. We had a lot of debt on our books for that effort, and this legacy debt from that attempt to buy that real estate existed until early or August of this year, 2023, where the operation we had through a relationship with the landlord, we were able to come to an agreement to purchase the building that we're currently in. And we actually simultaneously sold it to a sale leaseback fund. We made a lift of about $3 million on that transaction. And so that allowed us to pay off all debt, toxic debt, any kind of convertible debt. And the only debt remaining is sort of friendly or shareholder type debt, which we'll deal with when we get to the financial section. But we find ourselves to be very healthy with a very good operation here at the end of 2023. So next, just a little bit about our board. Myself, been a director since the beginning in 2010. We started in the addiction treatment space. Jerry Miller, who's a lawyer from Toronto, Canada. He's been on with us, excuse me, since I think around 2008. He's been with us for a while. And a third director that we had, unfortunately, who recently just passed away in November of 2023. And we have a candidate ready to go and in mind, but we'll be announcing that shortly. But otherwise, Jerry, myself, a lot of strong real estate and operating experience, business experience, both not kids. So that's the makeup of the board. As we grow and expand, we'll probably most certainly be expanding the board beyond 3 positions. We do have an advisory board who we consult with regularly, and all the people on this list are experienced, very experienced business people, and also shareholders or note holders in our company. So we have very close contact with our investors and with people that hold some of the debt in our company, and they also act as advisors for us, and a very capable and able group of advisors that we keep close to us. This is the leadership that we have at the treatment facility. Again, an excellent group of leaders at the treatment facility. Kate Rossborough, who's just been named as the executive director. Myself and the other owner partner were, acting as executive directors throughout the beginning and the onset of the startup of the business in West Palm Beach, but has now been turned over to Kate Rossborough as the executive director. She has been with us from the beginning, has an immense amount of experience in the treatment center industry, and she's doing an amazing job for us as we speak. Carl Heitz, who's also been with us almost from the beginning as a RN nursing director and manages all of our medical personnel, been excellent and with us from the beginning. And we have a couple of new people that have joined us recently. Dr. Elizabeth Woodruff in the clinical director position. Again, great amount of experience and very knowledgeable and capable in her role. And Roger Graves, who is a retired warden from a maximum security prison, worked with Federal Bureau of Prisons for 25 years and is now, retired and has been working in, with risk hit youth. And he's been working with people with adults with disabilities, and then became interested in the substance abuse space. So we're fortunate to have Roger with us, who's got an immense amount of experience in operating facilities. And just loves what he's doing and loves working with us. So we're proud to have him as part of our team as well. Next, a little bit about the market. As we all know, this is a part of the presentation I usually don't have to spend too much time on. Everyone knows the devastation that's out there with the epidemic of opioid addiction and the fentanyl problem, and it's just a growing problem. But some of the things that have worked in the behavioral health space, most recently, legislative tailwinds in the U.S. It's just there's a huge support for treatment. Again, as a result of the opioid epidemic. Back in 2008, Obama passed the Mental Health Parity Act, which made all people's benefits include mental health treatment, which included addiction treatment. So that was a boon for our industry. We have, 25 million previously uninsured Americans that have insurance. The marketplace policies that are out there today all cover addiction treatment. So there's a tremendous amount of coverage for this in the insurance marketplace. Industry is quite huge. As you'll see from the next few comments here, there's about 14,000 treatment centers in the U.S. Only 2 other public companies that are 100% behavioral health. So ripe for consolidation. There's all sorts of availability for acquisition and growth. Few numbers for you. 20 million Americans need substance abuse treatment. This number continues to increase. 2.4 million addicted to opioids. That's growing 15% a year. The market's about 35 billion a year in the U.S. And unfortunately, you hear these statistics all the time. 100 Americans die every day from drug overdoses, surpassing car accidents as the number 1 cause of accidental deaths. Just indicative of the issue and the problem and what's out there and what we deal with. And I always say, unfortunately, business is good because it means there's a lot of sick people and a problem that we have to deal with. A little bit further on some of the statistics, mental health facts and data. 18% of the adults experience mental health illness, or over 44 million American adults have a mental health condition. Again, the numbers are staggering. Florida ranked 43rd out of 50 states in mental health accessibility. These are all just indicators of how much demand and how much market there is for us to deal with. Some of the things that are on the horizon. Growing base of support for plant-based derivatives, or some of the things that from the substances occurring in the marijuana plant, cannabinoids, and some of the psychedelics and the mushrooms. There's a lot of different testing and trials going on right now with respect to new methods of treatment. MDMA is in a phase 3 trial. They do expect that will be approved at sometime in 2025. The psilocybin is not far behind that, and that they expect to have that approved in the near future. And we plan to be early adopters of any new protocol that is legal and licensed, and look very forward to finding better cures for the opioid addiction, because it's a difficult addiction to treat. It's unfortunate for those that become addicted to opioids. It's a terrible path to recovery, but one that we support and one we're successful with, and wish we could be, more like 100% successful than the lower success rates we have. But every win we have and every success we have, we're proud of, and we're very happy to participate in. This is a little overview of our facility in West Palm Beach. Probably not so easy to see, but the one slide is a picture of where the facility is right in downtown West Palm Beach. We're right across from the Tri-Rail station. We're a few blocks from the Brightline station, and a walking distance to all of the downtown core. And the building is a 3-story building. As you can see there, we house 58 beds in that building, do all of our treatment on the first floor. And next door to that building, there's a 5-plex where we have another 10 beds. This area of West Palm Beach is just an ideal location. It's great for the clients. It's great for their ability as they go through our treatment program to be able to go out and get jobs. So we're in an incredible location. And that's, sorry, by the way, that's the building that we did the sale and lease back on, this property that you see in this slide here. So there's a few interior shots of some of the units, pretty comfortable and nicely appointed treatment center. Clients are all very happy with the facility and very nice to see what they get when they come into our facility. I'm going to jump quickly to financial information. In 2022, if you can see there, the EBITDA for the treatment center, which is a subsidiary of our public company, so not including, other the public company costs and the Ethema costs, had last year a revenue top line of a little over $4 million with an EBITDA of $883,000. This year has grown in the first 9 months to $4.4 million in revenue and an EBITDA of $900,000 in the first 9 months. So obviously, the last quarter is still to be added. We did have a pretty strong quarter. I think we're going to be at about 5.8 million in total revenue, and EBITDA certainly going to be higher, in the 1.2 million range, most likely. So good, solid operation. And we like to use the EBITDA numbers because in terms of valuations, a lot of buyers look at the EBITDA number as a term of doing a multiple of the EBITDA. And quickly show you the income statement here from, we have both the 3 months and the 9 months ended September 30th, 2022. Even though, halfway down, you can see that there's a gain on the disposal of property, which is on the books there at 2.4 million. Overall, in the Ethema company, with everything else included, we're still showing a net income, after-tax income of little over 2 million for the 3 months ended September 30th and 1.5 million for the 9 months ended September 30th. That's an income per share, basic income per share of 0.0006 cents per share and 0.004 cents per share. As many of you know, we trade at or have traded at 0.0003 cents per share. So it's kind of a ridiculous kind of prospect compared to what we're making as a company and what we're making now, what we're reporting. But as you know, market isn't always reflective of what's in a company, and we expect that to see that change very soon. Quickly on the balance sheet, we do have, and if we look at December 31st, 2022, we were sort of upside down quite heavily in terms of the stockholder deficit of $9 million during the first 9 months of 2023. We've reduced that to 5.5 million. We do have and are talking to an investor at the moment who's looking to put $2 million into the company. But I would just point out that the remaining debt under the current liabilities are in the convertible notes section here. This is the 4.4 million and the 2.6 million are both friendly debts and related party debts, being me and my family, which amount to almost a little over 7 million. And it should be noted that debt is expected to be converted to equity at some point soon. And when we do that and combine that with another $2 million investment, we certainly would qualify under the regulations or the tier requirements of the New York Stock Exchange tier 1. And we do have the income that's required. We have the shareholder base required. We have all the requirements to uplist to NASDAQ, to New York Stock Exchange. So we expect that to happen very soon. And I know I'm running out of time here, so I'd like to maybe quickly take some questions. Anna, if you want to go ahead.
Great job, Shawn. Okay, we do have a few minutes. Let's see. First of all, you talked about the plan to grow 500 beds. That's fantastic. So tell us a little bit more about where you would add those beds and how would you get there in 2 years?
So real quick, we have the ability to expand with our current licensing and accreditation and insurance contracts within Florida by simply adding those to another location. So we expect probably to go to about 180 beds in Florida. That would be with 2 more locations. And we expect, and we've been looking at and have prospects for that. So we expect that that would happen and can happen fairly quickly. The other 300 beds, we would expect that to be by acquisition. We are looking at and have conversations going with several different operators, and those would be in the Southeast U.S. Outside of Florida, but primarily, Georgia, the Carolinas, Texas, those areas, and that's where we expect that growth to come from.
Roger Weber asks, what is your bed occupancy rate now?
So we traditionally, we hover around 50 to 55, even though we have 68 beds. And it's like a hotel where you can't always be perfectly occupied because we reserve spaces for people coming in next week or this week or later this week. And if somebody leaves, it's not as if we can fill the bed for 3 days. We have to, reserve beds. We currently, today's census is about 42, which is normal for this time of year. The facilities typically clear out over Christmas and the holidays. We never clear out, but the census usually drops. And so in January, we see that start to pick back up again. So we expect to be from the low 40s now to the, to 50 to 55 by the end of the month. And that will continue throughout the year.
And Joyce McDaniel says, with a valuation of $300,000 per bed, what is your cost of that bed per year?
So we generate about $35,000 to $40,000 per bed per year. And that's where we're looking at the valuation being sort of a 10 multiple of that number. And that's the fastest way to answer that question.
And Randy B asks, how many beds per room are there on average?
2 per room is our maximum. And in some cases, we have a single in one room.
And in your factors for success slide, you mentioned you have effective treatment for opioid addiction. So let's kind of wrap up and close with a little bit of that. Tell us more about that.
So that's a combination of really being a holistic kind of treatment center where we focus on, relational, emotional, physical. We don't focus just on the treatment that is talk therapy or talk, this is the traditional treatment. So by adding all these other different modalities and being a holistic kind of treatment program, we are small. We operate, we're not small, but we're smallish. We operate like a family. Everybody from the staff to the clients feel like they're in a therapeutic healing community. When we add those aspects to the traditional treatment, we find the success rates really climb.
And Stella Collier asks, how many facilities do you currently have in what regions?
So we just have the one facility now. It is in West Palm Beach, and we're looking again to expand into other parts of Florida.
And Will wants you to clarify, did you say that when you sold the Canadian facility, you kept the real estate that it's on? Is that your model, ownership of the land your facilities sit on?
So yes, we did. And I sort of skipped over that, but we did sell that facility, the Canadian facility, in 2023. So that was disposed of because when we were making the decision to do the sale leaseback with the facility in West Palm Beach, we decided that we would no longer be owners of the real estate. We will always be leasers of the real estate. We may have close relationships with the owners of the real estate, the sale leaseback company that bought our facility in West Palm Beach wants to, provide us with expansion funding. But, we got in trouble. We got hurt pretty bad trying to buy that one big facility in West Palm Beach. And that shouldn't be, the operation shouldn't have suffered from that. So we've made a decision to work closely with real estate owners. But with respect to what's going to be in Ethema, we'll keep real estate out of Ethema and strictly operations in Ethema.
Makes sense. All right, Shawn, we've got a lot more questions for you, but we're out of time. So that just means you got to come back and give us some more updates. Thank you so much for this important work you're doing.
Thank you very much. And thanks, everybody.
All right. We'll be right back, everyone.